Good morning, everyone. Today I'm presenting this retrospective study of our group from the University Hospital Mother and Child on deep learning reconstruction for low-dose pediatric brain CT. First, I have no conflicts of interest to disclose. So, to begin, brain CT remains one of the most frequently performed examinations in pediatric neuroradiology. However, radiation exposure is a major concern because children are more radiosensitive than adults and have longer lifetime during which radiation-induced effects may develop. Therefore, every pediatric CT examination should follow the ALARA principle, which is keeping the radiation dose as low as reasonably achievable. This radiation dose mainly depends on technical acquisition parameters such as tube voltage, current, pitch, and acquisition time. These parameters are adapted according to the child's age and weight. Nevertheless, lowering the dose inevitably increases image noise, creating the need for reconstruction techniques capable of preserving diagnostic image quality. First appeared iterative reconstruction, which represented a major advance over conventional filtered back projection by repeatedly comparing measured and estimated data. It significantly reduced image noise and allowed dose reduction of up to 80%. However, these reconstructions may be relatively slow, and the resulting images sometimes appear excessively smooth or artificial. More recently, deep learning reconstruction has emerged as the next generation of reconstruction algorithms. Instead of relying on repeated mathematical iteration, it uses a convolutional neural network trained on high-quality reference images. This enables efficient noise suppression while preserving anatomical details and producing more natural-looking images. This simplified algorithm diagram illustrates the principle of deep learning reconstruction, which uses a network trained to remove noise to obtain an image with good quality. The objective of our study was to evaluate the performance of the clear infinity deep learning reconstruction algorithms in pediatric brain CT. We conducted a prospective single-center study over a 9-week period. A total of 254 children aged between birth and 16 years underwent non-contrast brain CT. Patients were randomly assigned to one of 3 acquisition protocols with standard dose, 30% and 50% dose reduction. All examinations were performed using the same CT scan. We included all pediatric non-contrast brain CT examinations performed using our standardized protocol. We excluded examination with severe motion artifacts and patient presenting abnormalities that could interfere with objective measurement, such as major hydrocephalus and extensive white matter disease. This slide summarizes the study design. The 254 patients were randomly assigned to 3 groups. For every examination, images were reconstructed using 3 data sets: the native reconstruction, the Clearview iterative reconstruction, and the Clear Infinity deep learning reconstruction. This slide summarized the acquisition parameter used for each dose protocol for normal dose, low dose, and ultra low dose. The only parameter modified was the tube current, which was reduced by either 30% or 50%, while all other acquisition settings remained identical. This approach ensured that any observed differences resulted exclusively from dose reduction and reconstruction technique. Here are representative images from our study for both standard dose and 50% dose reduction groups. We compared the native images with Clearview iterative reconstruction and Clear Infinity deep learning reconstruction. Visually, the clear infinity provides cleaner image with less noise while preserving the fine anatomical details. So the image quality was evaluated using both objective and subjective assessments. The objective assessments included radiation dose parameters, DLP and CTD vol, as well as quality metrics such as noise, artifact index, and noise reduction, and the contrast to noise ratio, which was measured at the centrum semi-ovale and the basal ganglia. In parallel, two senior radiologists independently performed a subjective evaluation assessing overall image quality, visualization of anatomical details, and gray-white matter differentiation. To ensure objective and reproducible measurements, region of interest or ROI were placed in predefined anatomical locations. Noise and contrast to noise ratio were measured at the centrum semi-ovale and the basal ganglia, while the artifact index was assessed at the level of the posterior cranial fossa. The same ROI placement strategy was applied consistently across all patients and reconstruction methods. I will now present the results of our study, beginning with the objective quantitative analysis. Patient demographics were similar across the three groups as expected. CTD, vol, and DLP decreased significantly with dose reduction. More importantly, despite the reduced dose, deep learning reconstruction significantly decreased image noise and improved contrast to ratio compared with the iterative reconstructions. All these differences were highly significant. Overall, our study demonstrated three major findings. First, radiation dose was significantly reduced. Second, image noise decreased. And third, contrast to noise ratio improved. All these improvements reached statistical significance. Perhaps the most interesting finding is that reducing the radiation dose by half did not degrade image quality. On the contrary, with deep learning reconstruction, image noise decreased further while contrast to noise ratio significantly increased. This demonstrates the ability of the algorithm to compensate for the increased noise associated with low dose acquisition. These clinical examples illustrate the practical impact of deep learning reconstruction with clear infinity, regardless of patient's age. Clear infinity image appeared cleaner with reduced noise and improved gray-white matter differentiations compared with both native and conventional iterative reconstructions. Subjective evaluation yield results consistent with the quantitative analysis. For every dose level, clear infinity received a significantly higher score for overall image quality, anatomical details, and gray-white matter differentiation. An important strength of our study is the excellent agreement between the two independent readers, demonstrating excellent reproducibility of the subjective evaluation. Overall, our finding indicates that deep learning reconstruction significantly improve both objective and subjective image quality, regardless of radiation dose. Most importantly, it enables a 50% dose reduction without compromising diagnostic confidence. These results are consistent with previous publications, particularly those by Kim and Sang. Similar reduction in image noise and improvements in contrast have been reported using deep learning reconstruction. Interestingly, the benefits become even more pronounced as radiation dose decreased, making this technology especially attractive for pediatric imaging. Our subjective findings also agree with the existing literature. Radiologists consistently preferred deep learning reconstruction because anatomical structures appeared sharper and the gray-white matter differentiation was more clearly visualized. Our study has several limitations. First, it was conducted at a single institution using one CT scan. Second, subjective evaluation mainly include examination without major pathological abnormalities. Future multicentric studies involving different CT manufacturers and acquisition protocols are needed to confirm these findings. It would also be interesting to investigate the role of radiomic and quantitative AI tools combined with deep learning reconstruction. In conclusion, deep learning reconstruction represents a major technological advance in pediatric brain CT or brain imaging. In our study, it enabled radiation dose reduction of up to 50% while maintaining and even improving image quality. This technology, therefore, has considerable potential to optimize pediatric CT protocols while fully respecting the LRA principle. Thank you for your attention. This was all my references. Thank you.